Yes, good afternoon. We are for waiting for some students to join, some more students to join, and we are going to discuss about mumps and rubella today. We have previously discussed about measles. Now we are going to start with mumps and rubella today. Do you remember what are the clinical features of measles? What are the clinical features of measles? Write down in chat box. We have discussed in previous class about measles. What are the clinical features of measles? Write down in chat box. What are clinical features of measles? Okay, those students who have joined recently, we are going to discuss today about mumps and rubella. I have asked one question. Previously, we have discussed about measles. So, what are the clinical features of measles? I'm waiting for your reply. What are the signs and symptoms of measles? No reply from your side. What are the signs and symptoms of measles or clinical features of measles? Till I'm waiting for your reply. What are clinical features of measles? Is my voice clear and audible to all of you? Can you all hear me? What are clinical features of measles? Yes, I am getting now reply. Pre-eruptive stage, eruptive stage, very good. Then skin rash, fever, muscle pain, loss of appetite. Okay, three stages. Yes, now I am getting reply. Right. So rash is main clinical feature. Fever is also one of the important clinical feature of measles. Yes, fever, sore throat, coryza, sneezing, cough, Koplik spots. Yes, Koplik spot is one of the most important feature of measles. Right. Okay, so we will start with mumps today. Okay, there was interruption in between because of the connectivity error. So now we are again back. PowerPoint is being shared to you. Okay, so measles. Now I think you are all able to see the PowerPoint, right? So measles epidemiology. It is acute infectious disease, right, caused by virus, which is the predilection for glandular and nervous tissue. So mainly this virus affect glands as well as nervous tissue. Remember this point very well. Let me select the pointer option. So mainly this virus has predilection to affect glands. So particularly salivary gland and nervous tissue. Okay, so here you can see this glandular and nervous tissue. Actually, it is not working. The disease occurs throughout the world. Morbidity rate is high, but mortality rate is negligible. So that is one primarily parotid gland. So here you need to remember this. It affects primarily parotid gland, right? So myxovirus, parotiditis. Remember the name of the agent. Source of infection, clinical and subclinical case. So here mainly it affects children. So any child who is suffering from mumps, that is the source of infection. So child suffering from mumps, that is the clinical case and subclinical case, they are the source of infection. Humans are only natural host. Period of communicability. Now you understand the meaning of period of communicability. Means that suggests that from during which period it is communicable to other person. So it is communicable from 4 to 8 days before the symptom. This remember that this is communicable from 4 to 8 days before the symptom. Suppose symptom begins today, so child is infectious to other 4 to 6 days before the beginning of the symptom, and a week thereafter. After beginning the symptom until 7 days, 7 to 8 days, child is communicating the disease to others. So 4 to 6 days before the symptoms and a week thereafter, child is communicable to these communicating symptoms to other. Secondary attack rate is 86%. Secondary attack rate said that means if one child is affected, how many children it can affect. So in if 100 children are there in contact of that child, it can affect 86 children. That is secondary attack rate. So it is very easy to remember, simple. Mumps virus, here you can see in staining cells with the mumps virus. Here it is stained by hematoxylin eosin and stain. Host factor. So mostly age and sex, it is the disease of childhood. So all the children are more susceptible to disease. So this is the disease of childhood. 5 to 15 years child are affected with this mumps. Disease is more severe in adults than in children. If it happens in the adult, this disease is very much severe. One attack confirms lifelong immunity, same as measles. If you remember measles, one attack, if you have measles one time, then in lifetime you will not have measles. So it confirms lifelong immunity. So what are other diseases in which there is lifelong immunity? I have given example previously also. Can you name another disease in which there is lifelong immunity? Till you answer, we are moving ahead. So write down your answer. Which is other disease in which there is lifelong immunity? Second attacks are rare. So remember the difference between this second attack and secondary attack. Previously we have seen that secondary attack. Here you can see secondary attack rate is 86%. So secondary attack rate means if in a school, if one child is suffering from mumps, and there are other 100 students who are in that child's contact. So among that 100 students who have not taken the MMR vaccine, suppose this student have not taken the MMR vaccine, we will discuss about that also. And previously we you know about this MMR vaccines. So these children are unprotected. So among these 100 students who are in contact with the child who is suffering from mumps, 86 may develop disease. Around 86 may develop disease. So that is called secondary attack rate. Now, second attack rate. Second attack rate means if the child has mumps, again child develop disease after some years. That is called second attack rate. That is rare because it confirms lifelong immunity. So I have asked you that which are other diseases in which there is lifelong immunity. Write down answer in chat box and name of other disease in which there is lifelong immunity. Infant below 6 months are immune due to maternal antibodies. Infant below 6 months from this mumps, right? Environmental factor, it is an endemic disease. Endemic disease means which is constantly present, right? Constantly present in each and every part of the world. Particularly if we talk about India, it is constantly present. Peak incidence, however, occurs in winters and spring, same as measles. Peak incidence occurs in winter and spring. Yes, I have got the answer, chicken pox, right? So chicken pox is another example of the disease in which there is lifelong immunity. Once you have chicken pox, then there will be lifelong immunity. Leprosy, I am not sure with leprosy. It is not so. Leprosy, it does not give the lifelong immunity. But yes, chicken pox is definitely. Okay. Epidemic are associated with the overcrowding. If there is overcrowding condition, epidemic occurs. So in countries with overcrowding condition, there are more chance of epidemic of any disease, any viral disease. Mode of transmission is corona droplet infection. Droplet means if any child is suffering from mumps, child coughs or sneezes, so the droplet come out through this cough or the sneezes, whatever the particles come out through the sneezing or through this cough, it is called droplet. And if it comes in contact with another child, it transmit infection. Direct contact with the infected person is also one of the another mode. Incubation period is 2 to 3 week, usually 18 days. So long incubation period. Incubation period, what is incubation period? Write down in chat box. What is incubation period? Write down in chat box till we are discussing further things. Clinical feature, generalized infection. Clinically, it is characterized by pain and swelling of one or both parotid gland. This pain and swelling of parotid gland or other salivary gland, mainly parotid gland. So there is parotitis, gums. So this mumps will lead to parotitis, right? So there will be swollen parotid gland, right? So parotid gland will be swollen, and it is known as in Gujarati there is also one another name for this mumps. You remember that gal pachodiyu. Gal pachodiyu is what? It is mumps, right? Yes, some students have written measles, rubella. Yes, incubation period, time between entry of organism and development of symptoms is incubation period. Very good. Development of first sign and symptom, you can say like also that, right? So we are discussing about clinical feature, right? Pain and swelling of one or both the salivary gland, mainly parotid gland, fever, earache. Because of the salivary gland swelling, there can be earache, right? Fever, as it is viral infection, there is fever. Pain and stiffness on opening the mouth. Definitely it will happen because there will be swelling of the salivary gland. And because of the swelling of the salivary gland, while you open the mouth, while child try to open the mouth, there can be pain and stiffness over the mouth. So these are very important clinical feature and easy to remember. In mumps, clinical features are very easy: fever, salivary gland swelling, pain and stiffness in and around the mouth, earache. It also affects testes, pancreas, CNS, ovaries, prostate, etc. And in severe cases, there can be fever, headache, constitutional symptoms. they can be present. Swelling subside over 1 to 2 weeks. So it will take 1 to 2 weeks to subside to the swelling. As it is viral infection, it will subside by itself. Right? We have to give only symptomatic treatment. Again, you can see the photographs of the mumps. You can see that swelling over the face region, over the cheek region. You can see both sides swelling over the cheek region. Child is crying out of the swelling, and this typical feature of mumps. Complication include orchitis. If it involves testis, there can be inflammation of the testis, so it will lead to orchitis, ovaritis, pancreatitis. If it affect ovaritis, then pancreatitis, meningoencephalitis in brain, myocarditis in heart. CNS involvement occur in 60% of the cases and indicated by pleocytosis in CSF. So CSF examination is uh, it is the investigation for detection of the involvement of the CNS. Mumps causes 10 to 15% cases of aseptic meningitis. Right? Meningitis is there, aseptic meningitis. Meningitis and meningoencephalitis resolve without sequelae, but sometimes results in deafness. So here it resolves itself, but it can lead to deafness in some cases also. Rare complications include nerve deafness, polyarthritis, and hydrocephalus. Diagnosis, of course, by clinical features only. Clinical features are very simple. Clinical features are very simple. Infection starts with appear of the symptom. Yes. Then so this clinical features gives you the hint for diagnosis. Write down the clinical features of mumps. What we have discussed. No comments will be allowed apart from only answers. Somebody has written some comment. No comments over here. So what are the clinical features of mumps? Very easy. Clinical features are very easy. Write down the clinical features. So diagnosis is by clinical features only, right? And you can go for some investigations, but no need viral isolation from the secretion, serological test, yeah? But this is not needed. Prevention strategy for prevention. You can give the name of the vaccine. You already know that measles, mumps, rubella vaccine, MMR vaccine. It is to be given between and around the 15th month of the age. So strategy for prevention to remove the burden of the mumps illness in community by achieving and maintaining high immunization level with the vaccine. And vaccine you already know, mumps vaccine, it is live attenuated vaccine available. Right? So the name of the strain, Jerry strain. For mumps vaccine, the strain is Jerry strain, single dose 0.5 ml IM or subcutaneous. Combined vaccine, usually mumps vaccine, we are not giving this isolated mumps vaccine, we are not giving this, right? We are giving this combined vaccine, right? MMR vaccine, measles, mumps, rubella vaccine. First dose is around 12 to 15 months, around 15 months of the age, and second dose is around 4 to 6 years of the age. Vaccination produce seroconversion in 9 to 95% of the vaccine. So those children who have received vaccine, suppose 100 children has received the vaccine, so among 100 children, 95% will get the antibody. They will develop antibody against mumps, so it will protect against mumps. Yes, I have got the answers of previous question. Fever, swelling of the parotid gland, earache. Yes, right. Stiffness of what? Stiffness of neck, right? And difficulty in opening the mouth, pain, right? So these are the clinical features. Yes, very good. We have discussed about vaccine. So indication for vaccine in private setup. Private setup is a form of MMR vaccine. But you know that in government setup, MR vaccine is there. Measles and rubella vaccine is there. Here, mumps component is not there in our national immunization schedule. So the vaccines which are what vaccines are included in national immunization schedule? The vaccine which are having the major public health problem, they are only included in the national immunization schedule. As you know that due to mumps, mortality is negligible, almost zero mortality is there, so it cannot be said as the major public health problem, right? So mumps vaccine is not included. It is not required as per the government guideline in national immunization schedule. But of course, it is available in private setup. So contraindication: pregnancy, immunocompromised, immunosuppressive therapy is child is receiving, severely ill patient, hypersensitivity to neomycin, that is antibiotic drug. MMR, adverse reaction of the MMR: fever, rash, joint symptom, thrombocytopenia. Right? Thrombocytopenia is decrease in platelet count. Parotitis and deafness are very rare. Encephalopathy is very rare. But fever, it can be there in any vaccine, MMR vaccine also. Treatment: if the mumps develop, that was about prevention, that MMR vaccine. Now if the mumps develop, then treatment will be mainly symptomatic, as the mumps virus resolve by itself. We did not to give any, or we do not have any antiviral drug against the mumps. Warm and cold pack may be applied to soothe the affected area. As you know that swollen parotid gland is there, so difficulty in opening mouth, pain and stiffness around the mouth will be there. So warm pack or cold pack, it may be alternatively applied to give the soothing effect, pleasurable effect to the child. Aspirin cannot be used, should not be used as the treatment viral infection. It causes Reese syndrome, and as you know that there is thrombocytopenia that occurs actually with the vaccine. But Reese syndrome, aspirin has adverse effect known as Reese syndrome in childhood, so it could not be. It is not to be given. Control is difficult because this is infectious even before the diagnosis is made. Do you know the period of communicability? This sentence is very important. Control of this disease is difficult, same as corona. Control of the many viral condition is difficult because disease is infectious even before the diagnosis is made. So it indicates what period of communicability. So what is the period of communicability for mumps? Write down in chat box. What is the period of communicability for mumps? Period of communicability we have discussed today. So you will incubation period, it is there. Write down incubation period also, we have discussed today. Waiting for your reply. And presence of subclinical cases, the cases which are not having symptoms, asymptomatic cases, subclinical cases are present, and that can spread infection from one person to another person. So because of this reason, so control is difficult. So I have asked that what is period of communicability in mumps and what is incubation period in mumps. Today we have discussed. Write down in chat box. Still then we are going forward discussion. Vaccination of all school children with 2 doses of MMR vaccine. Previously, it was done. Increased use of the lab confirmation in suspected cases of the bombs. Lab confirmation cases isolated until the swelling subsides. So isolation. See, you are nowadays hearing this word since many months: isolation and quarantine. So in viral infection, isolation of the case. So if child is suffering from mumps or measles or chickenpox, child is not allowed to go to the school, right? So we isolate the child, isolate the patient. Isolation is for patient, quarantine is for healthy person. So here also isolation until the swelling subside, because child may be spreading infection until that period, right? And use of the lab confirmed cases, disinfection of the material in which patient is in contact, surveillance of the contacts. So whatever the contacts are there, suppose child is having the mumps symptoms today and child is present in the school, so we have to keep the track of the contacts of all the children, whether any other child develop disease or not. So surveillance of the contact. So I have asked you 2 questions. What is period of communicability? Yes, many. First of all, incubation period, 18 days incubation period. It is very easy to remember. So some student have answered yes. So 4 to 6 days before the symptom and week after the symptom. Many students have correctly replied. So even if the symptom begin 4 to 6 days before the child is infectious to other children, so it is having this type of the period of communicability, and week after that, so control is difficult. So that is all about mumps, and our another part is there: measles, mumps, and rubella. So here I am sharing the PowerPoint of rubella also. Let me give some time. Rubella, right? So this As you know that measles, mumps giving in combined, and so we are discussing this disease also simultaneously. Why it is not working? Okay, the PowerPoint is open and I'm sharing it soon to you. So it is also a very short topic, rubella. Another name for rubella is German measles, right? So measles you know, but the another name for rubella it is German measles. So the type of the virus for rubella it's Toga virus. It is RNA virus. Type of the virus it is Toga virus, and it is RNA type of virus. You know that basically there are two types of virus: RNA virus and DNA virus. Among them, this is RNA virus. It has one antigenic type, so it is good if any virus is having only one antigenic type. It is good to prevent. It is good for us to prevent because we can easily develop vaccine. And meanwhile, I give you one message that there was one invitation that if you want to participate in human trial of this corona vaccine, then there was one advertisement that you have to mail. One email ID was given, and I did applied for that. I have written that mail. I have mailed them. It was conducted by AIMS, but immediately I got the reply that this is only for those persons who are residing in Delhi. So they are conducting this human trial of the corona vaccine, but only the human who are residing in the Delhi they can participate. Otherwise, it was an opportunity to participate in human trial. But they replied like that. Rubella virus, it is rapidly inactivated by chemical agent, ultraviolet light, low pH and heat. So it is easy to disinfect. Chemical agent like Griseldia preparation, which can easily inactivate this rubella virus, as well as ultraviolet light. So these are the modes of disinfection, how to disinfect rubella virus or any surface from rubella virus, low pH and by heat. Rubella epidemiology reservoir of the infection is human, so it resides inside the human being. Reservoir means which contain this virus. Reservoir means contain the virus. So human contain this rubella virus. So transmission is by respiratory route. Subclinical cases may also transmit the infection. Temporal pattern peak in late winter and spring, like measles and mumps. Communicability, again, this is period of communicability 7 days before and 5 to 7 days after the appearance of rays. Remember this period of communicability 7 days before and 5 to 7 days. In both the things, you can remember 7 days. 7 days before the appearance of the rays. Suppose this is rash. So this is the day in which on which rash appears. So 7 days before the appearance of the rash, patient is transmitting the infection, and 7 days after the appearance of the rash, patient can transmit infection. Right? This is the period of communicability. Infant with congenital rubella syndrome may shed virus for 1 year. So those infant who have congenital rubella syndrome means those infant who have affected by their mother. If mother is having the rubella, then the child developing the child who is delivered, mother is infected with the rubella during pregnancy. So the delivered child may have the congenital rubella syndrome. Almost 90% chance that the child who has been delivered, it may be having congenital rubella syndrome, and it may shed virus for 1 year or more. Incubation period for rubella is 14 days. Range is 12 to 23 days. You can remember this 14 days. Prodromal symptom include low grade fever. Then there can be lymphadenopathy in second week. Right? So clinical feature include low grade fever, lymphadenopathy in second week, and there are rash. Which type of the rash? Maculopapular rash. Same as in the measles. Maculo means flat lesions. Papule means raised lesion. 4 to 17 days after the exposure. So rash develop 14 to 17 days after the exposure. Complication of the rubella include arthralgia, means joint pain, arthritis, and inflammation of the joint, in adult female and children. Right? Thrombocytopenic purpura, encephalitis. No need to remember this number. Forget this number. Just remember this complication: arthralgia, arthritis, right? Thrombocytopenic purpura, encephalitis, neuritis means inflammation of the nerves, and orchitis. Testis is inflamed, but it is very rare. But the important thing is congenital rubella syndrome. Again, I repeat, congenital rubella syndrome is what? If any mother during pregnancy, if she has rubella, so the child will be affected by the congenital rubella syndrome. Newborn will be affected by congenital rubella syndrome. This rubella virus from the mother, it passes through the placenta to the uterus and through to the fetus. So the developing child may be affected by the rubella, and newborn will be having congenital rubella syndrome. What are the clinical features of congenital rubella syndrome? It is characterized by these three main clinical features. Triad. It is called as triad of congenital rubella syndrome. Triad of congenital rubella syndrome. Deafness. So the ears are affected. Cataract. Eyes are affected, and heart defects. So first, remember these three main symptoms: deafness, cataract, and heart defect. Apart from this, there can be microcephaly. Microcephaly means small head. Mental retardation. The child is mentally retarded. Bone alteration, and liver and spleen damage. So these are the main clinical features of congenital rubella syndrome. So I'm giving you 15 seconds. Remember these clinical features of congenital rubella syndrome. Try to remember the clinical features of congenital rubella syndrome. Try to remember clinical features of congenital rubella syndrome. It's very easy to remember: deafness, ear, eye, and heart. These three. So that is congenital rubella syndrome triad: deafness, cataract, and heart defect. Then microcephaly. If the head is small, it will lead to mental retardation. Then bone alteration, liver and spleen changes. Right? Then rubella vaccine, as you know, it is given in form of the MR vaccine or MMR vaccine. In National Vaccination Schedule, government. Remember the schedule when MR vaccine is given. I have also told you in case of while we were discussing about measles, when MR vaccine is given, till then we are seeing further live virus. Rubella vaccine contain live virus RA273 strain. Efficacy is 95%, very large efficacy. It can be with a 97% efficacy also. So almost the child is, if child is given rubella vaccine, 95%, 97% chance that child is protected by the rubella. So protection is very high. Duration of the immunity is lifelong. If you take vaccine now, right, so the protection will be lifelong. Apart from the child, it is also given to the given in case of the women, right? So it is given to the women of reproductive age group to prevent the congenital rubella syndrome. So when, at what age MR vaccine is given? Do you know? At what age MR vaccine is to be given? Write down in chat box at what age it is to be given. Schedule at least one dose, but nowadays two doses are given. Not one dose, two doses are given at different age. What is that age in case of the childhood? MR vaccine is given at what age? MR vaccine is given at what age? Write down in chat box. Age for giving MR vaccine. No answers. What is the age for MR vaccine? There are two doses. First dose is given at the age of 9 months. Yes, first dose at 9 months and second dose at 15 months. Between 16 to 24 months actually. Second dose for MR vaccine is between 16 to 24 months. This MMR vaccine is given between 12 to 15 months. Right? So 9 months first dose MR vaccine, and between 16 to 24 months second dose is given. Yes. It is not changing. Okay. These are different vaccine trade name for rubella vaccine. No need to remember those trade names. Rubella vaccine is given to all infant 12 months of age or older. It is given before 12 months also. So just forget about this 12 months. It is given at 9 months and between 16 to 24 months. No need to remember here also. Rubella immunity, one dose, two dose can give, two dose of the rubella can give lifelong immunity. No need to go into this detail. Yes, MMR adverse reaction. Adverse reaction we have already seen: fever, rash, joint symptom, thrombocytopenia, parotitis, deafness, encephalopathy. We have seen in case of the mumps also. These are similar. Contraindication of MMR vaccine or MR vaccine: severe allergic reaction of the with the prior dose, pregnancy, immunosuppression, patient on immunosuppressive therapy, moderate or severe acute illness, recent blood product if any child has taken, suppose child has taken whole blood or PCV, then MMR vaccine is not to be given. Vaccination of the woman pregnant during pregnancy or before pregnancy, during reproductive age group also MMR vaccine, MR vaccine, sorry, rubella vaccine can be given. Rubella vaccine, not MM component, only rubella vaccine is given. So patient should be asked if the pregnant woman wants to become likely to become pregnant in next 4 weeks. Then if woman say yes, then there can be this becomes the indication for giving rubella vaccine. So that is all about mumps and rubella. That is all about mumps rubella, and there were both short topics. So we have completed with the measles, mumps, rubella triad, right? And next time we will discuss another infection. So our schedule will be at 2 p.m. on both the days, Monday and Thursday. Write down your roll number and then leave. Write down your roll number in chat box and then leave. I'm giving you 30 seconds to write down your roll number and then leave. Okay, fine. Thank you.